gives me an immense pleasure to thank Dr. Sankar Subramaniam to giving me this opportunity to talk on why do we sleep. Everybody needs to sleep. Sleep is as important as food, air, water. Okay. Prioritizing your sleep health is key to the maintaining that energy and thriving every day, as said by Dr. Lourdes Del Rosa, World Society, Sleep Society Secretary. Sleep helps us in improving our immune system. It clears bacteria and viruses. It helps to support memory and learning. Sleep helps to clear toxins from brain and improves brain health. Sleep helps to recycle old cells and maintain bodies and energy levels. Coming to sleep and immune system, this study by Krishna Kumar Singh has clearly defined that disrupted sleep cycle results in rush of pro-inflammatory cytokines, which signals local inflammation leading to neuronal damage and CNS inflammation. And also inflammatory genes expression are increased because of disturbed sleep awake cycle. Nuclear factor kappa B increases in production, and IL-6 and TNF responses are absent. So all this leads to disturbed immune response. Another study by Adriano Zagar in his book Neuroimmune Aspect of Sleep and Wakefulness, chronic sleep deprivation increases local inflammation, increase in IL-6, TNF, and increasing leukocyte trafficking. All this leads to local inflammation and disorganized immune response. And these are mostly bidirectional. Any dysfunction in immune system can lead to increased sleep pressure, increased sleepiness. That's why we sleep a lot during our illness. Okay. Another study by University of California, San Francisco says that short sleepers are 4 times more likely to catch a common cold. Also, a person who is sleeping less than 5%, it has around 45% chance of catching a cold. Sleep deprivation increases anti-tumor cytotoxicity. Best thing to do when we are sick is sleep. Sleep itself helps to heal better. Okay, sleep allergy. In this article, Ahmad Al-Maslamani says about relation between sleep and asthma, sleep and allergy. Okay, patient who has genetic predisposition to allergy with sleep deprivation have increased risk of asthma, and because of impaired immune response, asthma episodes are increased, and nocturnal asthma leads to circadian rhythm changes. Then now coming back to sleep and memory and learning. Sleep helps in consolidation of our memory. Whatever we learn in the morning, during our REM sleep, all these are consolidated, and next day we can retrieve this. Usually during morning we learn, and during sleep all these are imprinted into neural archives, and these are taken as memories. These memories are interconnected, forming relatively bigger database which helps in creativity. Sleep and Alzheimer's disease and dementia, and clearance mechanism is disturbed in sleep deprived individuals, and increased tau protein, which is one of the earliest observable Alzheimer's disease pathology, is seen increased with sleep deprived individuals. So we have to sleep to remember, and remember to sleep. Okay. and sleep and emotion. These are interconnected, uh, and intact sleep is very crucial for general well-being. REM sleep and non-REM sleep and dreaming play a modulating function on our emotions experienced during day. And a study by Nimhans for the need of the sleep clinics in psychiatric patients clearly describes that most of the psychiatric disorders are associated with sleep deprivation or sleep pathologies. So, and as an Irish proverb says, a good laugh and a long sleep are the best cures in the doctor's book. Then coming to sleep and weight. Sleep deprivation leads to increased ghrelin secretions, decreased leptin secretions, which increases our hunger. Then it gives increased opportunity to eat. All this leads to increased caloric intake, which ultimately leads to obesity. Other than that, altered thermoregulation, increased fatigue leads to reduced energy consumption. So, adipose deposition increases, fat deposition increases, leads to obesity. And other thing is increased stress hormones like catecholamines, corticosteroids production in sleep deprived individual leads to reduction of alertness and concentration. Another study by Sebastian Smith says a single night of sleep deprivation also increases ghrelin levels, which leads to feeling of hunger in normal weight individuals. Acute sleep deprivation increases portion size and affects food choices. And another study says sleep deprivation in type 1 diabetes leads to unhealthy dietary choices, especially in dinner. Sleep deprivation has marked effects on food intake, shifting choices toward energy dense options. So, obesity and sleep form a bidirectional relationship. Okay. Because of sleep deprivation, there is increased caloric intake, decreased physical activity, increased ghrelin secretion, decreased leptin secretion, increased cortical secretion, orexin dysregulation, then local inflammation, autonomic dysregulation, and vascular dysfunction. Also, insulin resistant dyslipidemia, arterial hypertension, and there is change in microbiota diversity. All this leads to obesity. Okay. Sleep and coronary heart disease. So, short duration of sleep is independently a risk factor for coronary heart disease. And because of sleep deprived individual having more chances of obesity and disordered lipid metabolism, arteriosclerosis most common. Okay. Sleep and cancer. This study triad of sleep, immunity and cancer by Giuseppe Lanza says that circadian rhythm disruption leads to altered hormonal balance, which damages the DNA and leads to cancer. Also, tumor microenvironments are changed, and modulatory inflammatory cytokines are increased. Because of that, chronic inflammation, again high risk for cancer. So, sleepless nights also affect gene activity, especially genes which are regulating gene expression regulation, metabolism, inflammation, and stress response are affected. So, overall physiological mechanism which are potentially disrupted by short sleep are control of hedonic eating, energy intake is increased, cortical levels are increased, gut microbiome is disturbed, appetite hormones are disordered, leading to increased ghrelin secretion, circadian misalignment is there, insulin sensitivity is decreased, and fatty acid and lipid metabolism are disordered, leading to decreased physical activity. So, poor sleep is linked to obesity, diabetes, coronary artery disease, cardiovascular mortality. Poor sleep leads to lower immune response, create susceptibility to infection, and further reduces the sleep quality. Current sleep disorders like obstructive sleep apnea are associated with cognitive impairment, dementia, risk of seizure, and increased risk of stroke. poor sleep can result in reduced reaction times, impaired judgment, and cognitive impairment, similar to effect of alcohol intoxication. Drowsiness can impair safe driving, and even if driver does not fall asleep. So coming to sleep health, there are 6 dimensions of sleep. Duration of sleep, which varies with the age. In a normal adult, approximately 6 to 8 hours of sleep is needed. Efficiency of sleep, then timing of sleep, which is regular, should be in the night. Then alertness and quality of sleep, all this matters. So sleep is not a luxury; it is a non-negotiable biological necessity, as said by Dr. Matthew Walker in his book, Why Do We Sleep? Thank you.